Hey everybody, my name is Brenda Salas and this is my informative speech. Have you ever felt like you know nothing about diabetes? Well, diabetes is a common disease that many Americans have been diagnosed with. According to the National Diabetes and Statistics Report of 2014, more than 29 million people, or now 3% of the U.S. population, had diabetes. 21 million people diagnosed and 8.1 million people undiagnosed. About 208,000 people younger than 20 years have been diagnosed with diabetes, either type 1 or type 2 diabetes. How many of you know someone with diabetes? In my family, recently 2 of my cousins have been diagnosed with diabetes. One at 20 years old and the other one at just 4 years old. And I got to watch them squirm when they had to get poked. Even though they have gotten used to it, their lives have changed drastically. Today, I will be informing you about the 3 types of diabetes, what their symptoms are, and how we can treat it. There are 3 different types of diabetes. They are type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes, also known as juvenile onset diabetes, is a lifelong disorder in which the patient's body cannot regulate the levels of glucose in the blood. This type of diabetes may be caused by too little insulin, which is a hormone produced by the pancreas that helps the body use the glucose properly, or the body's resistance to using the insulin that is secreted by the pancreas. Type 1 diabetes is most common in children over 4 years old. It can also trigger adults who are in their late 30s and early 40s, but it is usually less aggressive in adults. Type 2 diabetes, also known as adult onset or non-insulin dependent diabetes, is when the body does not make enough insulin or the cells ignore the insulin produced by the pancreas. Those diagnosed with type 2 diabetes can get it by genetics or based on their lifestyle, with weight being the main factor. Gestational diabetes is an abnormal increase in glucose levels that occur during pregnancy. Gestational diabetes only begins when pregnancy has started. After the baby is born, it disappears. According to the Gale Encyclopedia of Diet, studies have found that in the United States between 3% and 10% of women experience diabetes during pregnancy. 90% of these women develop gestational diabetes, about 8% had type 2 diabetes, and about 1% had type 1 diabetes. Gestational diabetes is more common during the 3rd trimester of pregnancy. This is when the hormone reduces the amount of glucose that can enter the cells, so that more remains in the blood. Now that we know the top 3 types of diabetes, let's find out some signs to look out for. The symptoms of type 1 diabetes have obvious symptoms, such as frequent urination, increased thirst, and weight loss. The excess sugar spills into the urine, drowning water with it, causing you to urine frequently and increased thirst. Also, your cells are starved from the lack of nutrients from the loss of sugar, causing you to lose weight. The symptoms of type 2 diabetes can take a while to be noticed because blood sugar levels usually rise slowly. The earliest signs, if any occur, are the same as for type 1 diabetes, but they may develop rapidly enough to be early overlooked. Other symptoms can include bladder infections and tingling or numbness in the hands and feet as a result of nerve damage. Gestational diabetes does not cause symptoms, so you need to get tested for the condition. This is usually done between the 24th and the 28th week of pregnancy. Now that we know the symptoms, let's find out how we can prevent it. To treat type 1 diabetes, we need to keep the blood sugar levels within a target range. People with type 1 diabetes need to take several insulin injections every day or use an insulin pump. They also need to monitor blood sugar levels several times a day. Regular physical activities or exercise also helps to cope with diabetes. Exercise helps the body use more insulin efficiently. It also lowers your risk for heart and blood level disease. Last but not least, there should not be smoking or drinking. All of these treatments refer to type 2 diabetes and gestational diabetes. As you can see, is a very powerful disease. I just covered the different types of diabetes, the symptoms, and how we can treat it. By now, you should all be aware of this hurtful disease and how to help someone or yourself if it ever came to it.